ADHD is often described as a problem with paying attention, but that shortcut misses the bigger picture. Attention deficit hyperactivity disorder is a neurodevelopmental disorder, meaning it begins in brain development and affects how a person regulates behavior, attention, emotion, and action over time. The core symptoms are inattention, hyperactivity, impulsivity, and emotional dysregulation. But for ADHD to be ADHD, these traits must be more than occasional forgetfulness or restlessness. They must be excessive for the person's developmental stage, show up across multiple settings, and cause real impairment. A child who cannot stay seated only in one boring class may not have ADHD. An adult who misses deadlines, loses track of responsibilities, interrupts others, struggles to start tasks, and feels overwhelmed across work, home, and relationships may be dealing with something deeper than poor habits. At the center of ADHD is executive dysfunction. Executive functions are the brain's management systems. They help us plan, prioritize, inhibit impulses, shift between tasks, remember goals, estimate time, and keep effort going when rewards are delayed. These skills are not the same as intelligence. A person with ADHD can be highly creative, knowledgeable, and capable, yet still struggle to translate intention into consistent action. This is why ADHD is not simply a lack of willpower. Someone may sincerely want to begin an assignment, leave the house on time, stop scrolling, or respond calmly in a tense conversation, but the systems that organize action and self-control may not engage reliably when needed. Inattention in ADHD is not always a total inability to focus. It often appears as inconsistent control over attention. The person may lose track during conversations, skip details, misplace essential items, or fail to finish tasks that require sustained mental effort. Time management can also be severely affected. Minutes may feel abstract until a deadline becomes urgent. Future consequences may not create enough immediate pressure to guide present behavior. This can make life look chaotic from the outside: unpaid bills, unfinished projects, missed appointments, or repeated lateness. But internally, the experience is often frustrating and exhausting, because the person may know exactly what needs to be done while still being unable to organize the steps in time. Hyperactivity and impulsivity are the more visible parts of ADHD, especially in children, but they can change shape with age. In childhood, hyperactivity may look like climbing, running, fidgeting, or being unable to remain seated. In adulthood, it may become inner restlessness, constant multitasking, excessive talking, or an inability to relax without stimulation. Impulsivity can show up as interrupting, making quick decisions without considering consequences, spending recklessly, reacting sharply, or seeking immediate rewards. These behaviors are not always dramatic, but repeated over years they can affect education, employment, finances, driving safety, friendships, and romantic relationships. The problem is not one isolated mistake. It is a pattern of self-regulation failing at the moments when consistency matters most. Emotional dysregulation is another important part of ADHD, even though it is less widely understood. Many people with ADHD experience emotions that rise quickly, feel intense, and take longer to settle. Frustration, embarrassment, boredom, excitement, or rejection can become difficult to manage in the moment. This does not mean the person is immature or manipulative. It means that the same executive systems involved in inhibiting actions and sustaining attention also help regulate emotional responses. When those systems are weaker, feelings can drive behavior before reflection catches up. Over time, repeated emotional blow-ups or shutdowns can lead to shame, conflict, and avoidance, especially when others interpret the behavior as deliberate disrespect rather than impaired regulation. One confusing feature of ADHD is that it can include periods of intense focus. This is often called hyperfocus, although scientifically it is related to difficulty interrupting an ongoing response pattern. In other words, ADHD does not only involve trouble staying with a task, it can also involve trouble stopping a task when the context has changed. A person may spend hours gaming, researching, creating, working, or scrolling, even after deciding they should stop. From the outside, this can make ADHD seem contradictory. How can someone focus for 6 hours on one activity but not 10 minutes on another? The answer is that ADHD is not about attention being absent. It is about attention being poorly regulated, especially when motivation, novelty, urgency, and reward are uneven. The effects of ADHD can reach far beyond school performance. Executive dysfunction can impair professional reliability, household routines, relationship stability, and health behaviors. Someone may miss medication doses, delay medical appointments, eat irregularly, sleep inconsistently, take avoidable risks, or struggle with long-term planning. ADHD is also associated with other mental disorders and some non-psychiatric disorders, which can add further impairment. When these challenges accumulate, quality of life can be significantly reduced. Research has even linked ADHD-related impairments and risks to reduced life expectancy. That does not mean every person with ADHD will have severe outcomes. It means untreated or poorly managed ADHD is not a harmless personality quirk. It can shape real-life trajectories in measurable ways. ADHD can be hard to distinguish from other conditions because many symptoms overlap. Anxiety can cause restlessness and concentration problems. Depression can reduce motivation and slow task initiation. Sleep disorders can produce forgetfulness and irritability. Trauma, substance use, learning disorders, and autism can also involve attention or regulation difficulties. This is why diagnosis should look at the full developmental pattern, not just a checklist from one bad week. ADHD is typically understood as the extreme lower end of a continuous range of executive functioning and self-regulation. Everyone varies in these traits, like height or reaction time, but ADHD describes the point where the difficulties become developmentally inappropriate, pervasive, and impairing across contexts. The causes of ADHD are complex, and in most individual cases there is no single identifiable cause. The strongest evidence points to genetics. Meta-analyses estimate heritability around 70 to 80%, meaning inherited differences explain a large share of risk across populations. This does not mean there is one ADHD gene, or that genetics are destiny. It means many genetic influences combine, each adding small amounts of risk. Brain imaging, twin studies, and molecular genetic research all support the view that ADHD reflects biologically grounded differences in executive functioning and self-regulation. The disorder is not caused by laziness, bad parenting, too much ambition, or simply living in a distracting world, even though environment can affect how symptoms are expressed and managed. Environmental risks also exist, but they are not mainly about ordinary family style or social influences. The article highlights that environmental risks tend to act very early in life, especially during prenatal or early postnatal development. In rare cases, ADHD-like symptoms can result from a specific event, such as traumatic brain injury, exposure to certain biohazards during pregnancy, or a major genetic mutation. Because ADHD is neurodevelopmental, the idea of biologically distinct adult-onset ADHD is not generally supported, except when ADHD occurs after something like traumatic brain injury. Adults can absolutely be diagnosed later in life, but that usually means symptoms were present earlier and only became recognized when demands increased or coping strategies stopped working. Treatment for ADHD is most effective when evidence-based medication is used, often alongside psychotherapy or practical behavioral support. The main medications are stimulants, such as methylphenidate or amphetamine-based treatments, and non-stimulants, such as atomoxetine or alpha-2 agonists. These medications do not give someone a new personality. When effective, they improve the reliability of attention, inhibition, and self-regulation. Psychotherapy and coaching-style interventions can help translate that improved capacity into routines, planning systems, emotional coping skills, communication strategies, and ways to reduce avoidable friction. The goal is not to erase individuality or force constant productivity. The goal is to reduce impairment, risk, and distress so the person has more control over their own intentions. Lifestyle advice is common in conversations about ADHD, but it is important to separate general health from proven ADHD treatment. Sleep, exercise, nutrition, and structure can support overall well-being, and many people feel worse when these are neglected. However, the article notes that exercise and dietary modifications have no proven benefit as ADHD treatments in the same evidence-based sense as medication. That distinction matters because people with ADHD are often blamed for not fixing a neurodevelopmental disorder through discipline alone. A realistic view is both compassionate and practical. ADHD is a serious, biologically influenced condition involving executive dysfunction, but it is also manageable. With accurate diagnosis, effective treatment, and supportive systems, many people can reduce impairment and build lives that work with their brains rather than constantly fighting them. If you found this helpful, please like this video and subscribe for more explainers.